Hey, thanks, Angie. It's so nice to see familiar faces. Being a couple months into this now, I love when you guys hop on and I'm like, I know you, I know you. So thank you guys for hopping on this lunch and learn. And I was discussing this with Angie earlier that, chronic fatigue, whether it's cancer related or other illness related or something from COVID, is really life debilitating. So as a future occupational therapist, I love to give tips and tricks, I guess, because it really impacts our daily functioning. And as an OT, I care how people best function in their everyday lives. So, yes, I'm glad to share this with you guys. And as Angie said, I'm an occupational therapy doctorate student. Literally a month from today is when I defend and will get my doctorate, fingers crossed. So it's been a really nice experience thus far. So let me share my screen. Everyone see that okay?
Yep.
Okay. Cancer-related fatigue. Okay, so cancer-related fatigue, also known as CRF, is a persistent sense of tiredness related to a cancer treatment and affects everyday functioning. So cancer-related fatigue can be experienced before a cancer diagnosis, through cancer treatment, and unfortunately last post-treatment. CRF is the #1 side effect of cancer and cancer treatment. So 50% of patients experience CRF at diagnosis, and 75% of patients experience CRF with bone metastasis, and 80 to 96% of patients experience CRF with chemotherapy, and 60 to 93% experience CRF with radiotherapy. In general, 80 to 100% of cancer patients will at some point experience CRF. Causes. So there's physiologic causes to CRF, which before someone is diagnosed, they will feel fatigued and sometimes go to the doctor and say, wow, I'm just feeling so completely fatigued, no energy, washed out. And it's the type of fatigue, in general, CRF is the type of fatigue that does not go away no matter how much you sleep, how much rest you get. So sometimes cancer is diagnosed when a person comes in and says, I am just so depleted of energy. So a tumor may be an underlying cause. Once it's been detected, chemotherapy treatment is a cause of CRF. Sleep disorders on top of a cancer diagnosis. And then once someone is just diagnosed and not feeling well, they're going to be immobile, lack of exercise, which reducing that, you would think, oh, I'll conserve my energy. But research shows moving around more is better for your energy. So it's kind of a catch-22. And same thing, chronic pain. People who have rheumatoid arthritis, they say, it's hard to get up and get moving, but the best thing to do for fatigue, pain is actually to get up and get moving. So it's a little bit of a contradiction, but it really does help in the long term. And then there's also psychological factors. So anxiety and depression, which chicken or the egg situation, someone diagnosed with cancer are more likely to experience anxiety and depression. So it all relates. Signs of CRF, feeling tired and exhausted even after sleeping. So this is what I touched on a little bit before. It doesn't matter if you sleep 10 hours. Most people are going to wake up feeling fatigued. They might have a burst of energy right when waking up. Compared to their baseline yesterday, I feel good, I feel refreshed, but that may only last for a short period of time. Lack of energy to complete daily activities. So this is a big part of what I'm interested in as a future occupational therapist. I want to make sure that people can function in their everyday lives in the most normal way that they can and in the most independent way that they can. And it's kind of something that people take for granted. They don't realize that just getting a shower in the morning can be as taxing and energy sucking as it is, or simply getting dressed, or standing long enough to make your breakfast or lunch. Difficulty with concentration, thinking clearly, and remembering. So this just goes back to if you're just feeling so completely wiped of energy, naturally you are going to have a difficult time with concentrating. You're going to experience this kind of brain fog, difficulty producing speech, getting your thoughts across, just that, wow, I'm really exhausted feeling irritable, impatient, or unmotivated. So kind of all know in our normal lives when you haven't had a good night's sleep, and maybe it's not even the morning and you're like, wow, I need some time to at least wake up. It could be all day long. And really having to face that irritability and trying not to jump at people or get through your daily activities. And if you're working, that can be difficult because we have to work and play nice with others. But when you're just completely wiped, it's really hard. Lack of interest in activities. So this is just things that you are normally used to doing, activities that you like. Maybe you used to play tennis on Wednesdays and just don't have the energy to do that. Even the thought of doing that is completely taxing. Decreased time on self-care and personal appearance. So this can kind of relate to psychological effects too. If you're feeling depressed, we know that there's less likelihood to want to participate in self-care and complete a personal hygiene routine. But also if you're just completely wiped and the thought of doing a whole routine is just too much to think about, that's a sign that you're having a little bit more difficulty. Even most people like the feeling of getting a shower, feeling clean after. And if you're feeling that, oh, I'd rather just not and go the day without one, it could be a sign that something's off for you. And increased time in bed or sleeping. So if you are someone who doesn't wake up feeling refreshed, you might kind of linger in bed in the morning for an hour or even longer. And sometimes that laying there reduces your energy even more. I think people can kind of do that on the weekends when it's Saturday and you're like, wow, I don't have to get up. And then you kind of lay in bed for 40 minutes and you think later, wow, I don't feel so good. I probably should have just gotten up when I woke up. So, okay, diagnosing. There's actually no accepted definition of cancer-related fatigue, and there is no agreement on how it should be measured. There are a lot of increasing number of measurement tools, but none specifically that are considered necessarily the gold standard. There's a lack of adequate instruments to measure fatigue. And fatigue is a subjective phenomenon and thus assessed most accurately by individual self-report. So that leads to the importance of sharing your feelings with your medical team. Just because it is a symptom that we know is related to cancer and cancer treatment doesn't mean that a patient just has to accept that as life now. So it's really important to share how you're feeling and track how you're feeling over time. And I won't get too much into that because I'll talk on that later. CRF and quality of life. I'm super focused as a future OT on a person's quality of life because there's a difference between living and really living your best life. So 2/3 of patients stated that fatigue affected their everyday performance of activity. 61% of patients stated that CRF affected their life more than their pain measures. And this was an interesting finding from a study that I read, that from an oncologist view, they rated a patient's pain to be more clinically relevant to a patient's life than fatigue. So 61% of medical doctors thought for patients that, pain would be a bigger effect to a person's life. But actually 37% of patients only agreed with that. So from a patient's view, they rated their fatigue to affect everyday life more than their pain. And I think that kind of goes back to a lot of people, whether it's chronic pain syndrome or other pain causing syndromes, kind of learn to work through pain. And going back to that, just work through it. And the more you move, sometimes you experience less pain. And then also working out, you're creating natural endorphins, which are pain blockers. So there's a lot of ways to work through physical pain, or modalities, applying ice, applying heat, taking ibuprofen if you're able to. So it's surprising, but not surprising, that a lot of patients can look past their pain, but can't look past their fatigue that they feel. So assessing fatigue. Again, share with your medical team. You want to discuss with them when you first notice feeling fatigued. Discuss when you realize this type of fatigue was unusual for you. So it can be all of a sudden a crash, especially if you're, on board for chemotherapy or radiation, and wow, okay, this is not at all like myself. But even from diagnosis through treatment, you can kind of track from week to week, day to day, what's usual compared to your baseline level of energy. How your fatigue has progressed over the course of your treatment or since diagnosis. So again, just kind of checking in with yourself. And anything you have found on your own to assist with your level of fatigue. So maybe that could be a little of your own trial and error of things you've tried. Like, I feel better in the morning, so I do this activity. I've tried this supplement. I try yoga, other things before, coming to a resource like Cancer Support Community that utilizes those activities so well to assist a cancer patient and survivor. Next, what makes your feelings of fatigue worse? And how does fatigue affect your daily activities? So you do want to share with your medical team if you're having a really hard time completing the activities that you were once independent in. Especially, housework and chores, we all have to do them. Is it okay if the, laundry doesn't get done that day? That's fine. Or if the dishes sit on the counter for a little bit, that's okay. I think there's a little bit more concern when you're finding difficulty getting through what we call activities of daily living, which are your basic activities of personal hygiene, dressing, bathing, going to the restroom independently, and your ability to just simply move yourself. We call them transfers. So moving from maybe the chair, and you're finding, wow, I can't even get up from my chair anymore. Those are really important factors, because, that could, if you're feeling fatigued, even moving, you could fall, and that could lead to an even bigger issue. And how has fatigue affected your ability to enjoy life and life's everyday activities? Contributing factors to CRF, touched on this a little bit before, but pain, when you're experiencing pain, it's kind of hard to get up, move, can be a vicious cycle of, I feel pain, I'm tired, I'm not moving, I'm feeling pain from not moving, I'm tired. Same thing with depression and anxiety. Those psychological effects play a role in it, in that mood. And by not moving, your feel-good hormones aren't happening as much. Sleep is another big thing. You may be getting good enough quality sleep, but it persists with CRF. It persists sans the quality of sleep that you're getting. But I'll touch on that in a little bit, that there are factors that are sleep hygiene factors that create the best sleeping schedule and hygiene as possible. Anemia. Nutrition. So you want to take into account your weight fluctuating through therapy, the calories in, calories out, your fluid intake, and electrolytes. And lastly, activity. Exercise and addressing deconditioning. This is really important, especially with like sarcopenia. So you could actually have an obese BMI, but you're losing muscle mass like crazy. So this happens a lot with cancer patients, with the inactivity and what you do eat. You're not getting as much protein. You could be gaining fat, but losing weight, but you're losing muscle. So it can be a vicious cycle, which as you lose more muscle, that also affects your fatigue. So there is, when looking through the different measures, there is one that was specifically developed for cancer patients. It is the Fatigue Symptom Inventory, FSI for short. This scale is composed of 14 items, one of which is not scored and is designed, I'm a little blocked off here, but I think it says design and evaluate multiple aspects of fatigue, including its perceived severity, frequency, and interference with daily functioning. So I chose this one because this is the most pertinent from an occupational therapy perspective. I like understanding a baseline score, how often you're feeling that, and just your daily functioning. So those activities of daily living that as an OT, I'm most concerned with. FSI was developed to examine a wide range of fatigue related issues. And the scale has been primarily validated in cancer patients. The nice thing about the scale is it is self-report, so it doesn't need to be given by a doctor or any medical professional, and is quick to complete, 5 to 10 minutes. The scoring. It uses an 11-point Likert type scale that ranges from 1 fatigue rating to another extreme rating. So I actually have it up here, and 0 means not at all fatigued, and then 10 is as fatigued as I could be. So lower points on the scale denote less acute problems with fatigue. And a global score can be obtained for items 1 through 13. So I'll give Angie this PowerPoint, and the citation it is at the end of the PowerPoint, or you can just Google fatigue symptom inventory. Now, I don't have the complete scoring manual because it costs a pretty penny. So I'm thinking what you guys could do is do your score, add them up, and then just divide by 13. And basically, if you're at a lower score, it's just denoting that fatigue is less relevant right now. And I like this inventory because I think you could just use it as a weekly tracker. Just a quick overview, because it's on this Likert scale, to see, well, I'm mostly at 2s this week, or I'm mostly at 6s. And so just knowing that 10 is as fatigued as I could be, just get a gauge of where you're at. So I like this scale the best because it's just easy to track over time. So how to save energy and feel less fatigued from an occupational therapy perspective. I like to tell patients to bank and budget their energy. So I like people to think about their energy in terms of finances. So with money, a person saves money, they create a budget, they're going to operate within this budget, and then they can plan for a large expense, such as buying that new 4K ultra high definition smart TV. So think about your energy in this way too, especially if you're feeling like you're in an energy deficit, but we want to keep living our lives. We pre-COVID, we have parties, we have dinner parties, we have things that we're looking forward to. So back when the world opens up again and we're a little bit more normal, your fatigue is still going to persist likely and unfortunately. So what can you do to not have to forego those activities, especially if they're evening activities when people are most likely pretty whipped and tired? So think about your physical energy in the same financial plan. If there's an event you want to go to in the evening when you're most likely tired, bank your day energy, take rest breaks during the day, and avoid strenuous activity during the day in preparation for your event. So if you can hold off on going up and down a couple of sets of steps in a day to do your laundry, like save it for the next day. So big thing, plan rest breaks during activities and adapt and modify your activities of daily living so that you can maintain as much independence as possible. Touched on this a little bit before, but ADLs include activities such as your bathing and personal hygiene routine, dressing, toileting, and eating. And part of eating is, for us, from an OT perspective, is not just physically eating, but a person's ability to prepare a simple meal. So it's not preparing a 5-course meal. It's just, does this person have the ability to make a peanut butter and jelly sandwich? Something more basic. So I'd like to touch in with you guys on some energy conservation for dressing. And if anyone has any questions at this point, feel free to unmute yourself or write in the chat. Angie will look out for the chat for me. Okay, no one has any questions. Are we good, Angie?
Sorry, let me unmute myself. Let's
You're
see.
good on time, so I can take any.
Yeah, many with cancer-related fatigue have symptoms, especially during COVID. And if you
Yeah.
have no job, true. Sorry, my scroll. Treatment like chemo and radiation can make one feel fatigue. And
Mhm.
I don't care attitude. This is normal among cancer patients. Very true.
Yeah.
So I think more just comments. I've heard that we all drag through the first week of daylight savings time change,
That's true.
and in the fall when we fall back in time. Yeah, all those, I would agree, all those things have
Yeah.
an
So,
impact.
yeah, that's very true. I mean, we kind of have our natural circadian rhythm. Our body knows. So even, the healthiest of people can experience these fatigue inducing experiences in life. So when you add that extra element of cancer treatment, which is very hard on your body, it's no wonder that people are fatigued, and it kind of is like a tumbleweed of adding more and more to it. And then it can kind of get away from a person. And then those psychological effects enter into play, and feeling depressed and anxious about how you're feeling. When am I going to feel back to normal? Will I feel back to normal? I don't like feeling like this. And it continues. So going over some energy conservation for dressing. Some tidbits here. Gather all items you will dress in at one time. So kind of think about what you have planned for that day, what you're going to wear. Go to your closet, pick out everything, and then bring it to your bed or your chair and be prepared to dress with everything you've picked out at once. Sit at the edge of your bed when putting on clothing, socks, and shoes. Dress your lower body before your upper body. You're going to be bending over. That exerts more energy, more stress. So it's just good to dress lower body first. Use an adapted figure 4 dressing technique to bring your leg over the other leg to avoid bending. Does that make sense to you guys? In the hospital, I always show patients, but just kind of hiking your leg. You guys still can't see, but like hike your leg over. So you kind of look like a 4. Don underpants just means put on. Don underpants and pants at once, and then pull up together to pull them up in one stand. So instead of doing 2 stands, you're getting everything ready, and then just do 1 stand and you're good to go. Use adaptive equipment such as a sock aid, a shoehorn, and a reacher to assist with your routine. Are you guys familiar with adaptive equipment? You can just give head nods. Yep, see, Cheryl knows. Everyone knows. A good old sock aid. They can be quite tricky to learn in the beginning, but they are a very helpful resource for anyone. I educate most patients once they've had a hip replacement, but they can help with in general. So just with energy conservation. And then lastly, it might not be the most enjoyable thing, but choose easy to don clothing such as t-shirts, pull-on pants, or pull-on shoes. At least in the time being, you might want to forgo your skinny jeans that you have to jump into and do a little shimmy to get those things buttoned. Go for just easy elastic pull-on pants, a throw over shirt, shoes where you don't have to bend over long and lace up, but also a shoe that's going to be stable. I definitely, as an OT, soon to be OT, do not recommend clogs or anything that doesn't have a back to it, especially if you are trip or fall prone. They can get jammed up. So an easy to pull on shoe that might have a Velcro fastener. Okay, to conserve energy for bathing and hygiene. You want to store materials for bathing and grooming in an easy to access spot. So kind of along the lines of your dressing, keep your most used items at an area where they're easy to reach, easy to gather. Utilize wall hangers for shampoo and washes, the little suction cup guys, to avoid bending over. Utilize a shower bench to assist with bathing energy. It's a big one, especially being in the shower with steam, hot water. If you're feeling a little fatigued, might be feeling a little dizzy, that can be unsafe. And that worries us. So when in doubt, if you want to be independent with your shower routine, get a bench, sit down, take a break. For ladies to bend out, you don't have to bend over as far to shave. But I would say try to do most of the routine as normal. And if that's standing for you, that's great. It's just a backup for the most safety. Use a long-handled sponge to limit bending over, exerting a lot of energy. Another thing, consider bathing in the morning when you have the most energy. I think it's good fuel for the day, but that's obviously patient to patient. You have to weigh the pros and cons of it. If you know that a shower is going to completely wipe you out for the day, that might not be the best plan. But if you feel like getting a shower would energize you in a way, it might be the better plan for you. So it really is just taking it at a person-to-person basis. And you might want to consider like a dry shampoo if you don't like the feeling of not having fresh hair but can't bathe every day. So dry shampoo is a girl's best friend and a great invention. So, it's not the preferred way, but if that's where you're at, that's where you're at. And there's activity modifications and product modifications that you can make in the short term. Sit down to put on makeup or to dry your hair. And lastly, safety for OT, install shower and toilet grab bars for safety. You might even want to install an elevated toilet seat if you're having difficulty getting down and up from the toilet for energy purposes. Okay, to conserve energy for making meals. Consider buying pre-cut fruits and veggies. I know they can be expensive, so that might not be an option for everyone. Maybe consider certain fruits or veggies over others. Maybe buying like a pre-cut squash or something if you really want squash, because that can be very difficult for anyone to cut, let alone someone with fatigue and depleted energy, or like watermelon pieces. Consider some healthy frozen meals as an option. I really like Trader Joe's for frozen options because I find that a lot of the options are, excuse me, not necessarily loaded with sodium and that like frozen food taste. So at least you can feel like you're eating a healthy, nutritious meal, and not sacrificing on the nutrition. Another big thing, use easy to open products and packaging. And I think a lot of food products are better in this way. I know my mom will say like, "Hey, can you come open this for me?" And she's 64, but she's just noticed difficulty with like opening containers and just not having the strength to do it. So I'll help her open stuff, but a lot of food products are getting better, like soup cans, just using the pull tabs. Rather than a can opener that you have to crank around. And pick one day to meal prep for the week. Meal prep in the morning and store meals for the week and take breaks as needed. Meal prepping can be a great example of that bank and budget your energy. So if you want to do a meal prep routine on a Sunday, kind of store up knowing that meal prep Sunday is your morning routine. Meal prep can take a lot of time initially in planning, but it'll pay off for your energy throughout the week. And some people don't like meal prepping just because they find the food not to be as fresh, and I completely understand that. So kind of play around with the meals that are still healthy, but are also going to maintain freshness. So, even if you want a meal prep for salads or something, invest in good Tupperware. Is that the is that the word that you can pre-store your dressing, but obviously we don't want dressing on a salad for 3 days. Like that would be a no-go. So just kind of think what works for you and what you want to change up week to week. But meal prep can be great. And also if you're operating within a more strict nutritional guideline, meal prep can be really helpful. Because we know if we have something that's already pre-prepared, pre-organized, we're more likely to stick with it. Okay, conserve energy for shopping. Consider drive-up grocery or store pickup options or home delivery. So home delivery, I think a lot of companies are offering it now, but your Amazon Market, you can get anything within 2 hours if you're willing to pay for it. So these have been a popular option during COVID, and I really think that they're going to stay around to meet customer needs, which is so great. I love that. Use a shopping cart to lean on as you walk through the store. So even if you don't need a shopping cart full of things, it's good to use a shopping cart to lean on rather than using a scooter. If someone needs to use a scooter, that's perfectly fine. But if you feel like you can get around the store walking, at least that shopping cart gives you a little bit of a rest break there. And take breaks during shopping as needed. So just let the crazy shoppers go on by. You don't want anyone going up your heels with a shopping cart, and just step aside and take a break as you need. And make a list so that you are sure to cover all items needed in a certain spot. And even when you're making your list, I know that there's kind of pre-written lists where it could be like meats, dairy, your snack stuff. Those could be helpful to organize like items. I will say I recommend this, but I am not a list maker, and I will go to Kroger and need something like completely on the other side. I'm like, oh, okay, I was already there. So I look as like, okay, I got more steps in, but for someone who doesn't have a lot of energy to do that and are fatigued, that they might likely forego that item that they need to go back for. And this kind of relates, but if you only need one or a few similar kind items, park closest to the door where these items are located. So if you know your local grocery store and there's 2 doors to enter and exit through, well, I know this end has meat and cheese and vegetables. The other side has dairy. Well, I only need milk. Go to the door that is closest to the milk. Okay, conserve energy for cleaning and chores. Consider using an iRobot vacuum such as a Roomba. They're not the best things. I have one, but it's a good backup to at least feel like you're getting something cleaned up. They can be a good resource. Now, getting them back to their docking station is a different thing, but at least if it cuts down on your task a little bit, they can be helpful. Use throwaway plates and utensils for easy cleanup and decrease cleaning dishes. So if you're making, your lunch or breakfast and it's just a simple sandwich that doesn't need a ton of plates and such to prepare, put it on a plate and just toss it. Then you don't have to worry about anything stacking up to clean later. Limit number of steps done each day, such as trips to the basement for laundry if your laundry is in the basement, or same thinking if you need to go upstairs for anything. Think ahead of time if you can, and think what might I need while I'm up there, or is there anything else I need in the basement while I'm down there to make the most of your trips back and forth. If you are going to clean, set a timer for cleaning you will get done in a 15 to 20 minute period of time and take a break after. So I think people can once you get started on a task, you kind of lose the day. You're like, wow, I was doing that for 2 hours. And you kind of have adrenaline going because you feel good that you're getting stuff done and you're being accomplished. And you might not notice it right away, but later you may feel completely just exhausted from that. So it's best to, rather than get carried away in what you have going on, see what you can do, not busy rushing around doing it, but set a timer for 15, 20 minutes, see what you can get done. And then when that timer goes off, say, okay, I'm going to take a rest break and get a gauge of where your energy is at that point. And if you can go back and do another 15, 20 minute period, great. If you can't for the day, then you just can't, and it's saved for tomorrow. For pet care, this is considered an instrumental activity of daily living. So it's not necessarily self-care for you, but if you have a pet, you have a responsibility to take care of them. So use an electric water/bowl feeder for your pets. I know they need to get cleaned out. You don't want to leave those, but at least it takes a task out of the way of you picking up multiple times a day a feeding bowl or a water bowl, and they can they go through it as they need it, and then you just pick up for cleaning purposes. And then make a realistic list of items to clean that day and chores to accomplish. So think ahead of time what you want to get done that day, what you have to get done that day, and think out your plans for the week too, because you can't necessarily know the next day that you're going to be, exhausted. It might just hit you that day. And I think it is good when patients do know their chemotherapy or radiation schedule, to kind of plan their activities that week around that if they know they're going to feel even more fatigued. And lastly, if you live with someone, ask for help when you need it. This is really important. I think most people really don't want to ask people for help. They want that autonomy. And it's not just the autonomy, it's I don't want to put other people out. But rest assured that anyone you live with and loves you would be more than happy to do that trip down to the basement for you or help you out. We just need to be better at sharing our needs with other people. Sleep and rest. Though CRF is felt regardless of the amount of sleep and rest, these habits can assist with getting, I can't see that, but basically the best sleep and rest as possible. So we want to establish a bedtime routine and create healthy sleep habits. This includes going to bed and waking up the same time every day, even on the weekend and even on vacations. Avoid caffeine 4 to 6 hours before bed. Reduce fluid intake before bed so you're not getting up and going to the restroom. If you do find yourself having to go to the restroom in the evening or once you're in bed, a person might want to consider a bedside commode that they can empty the next day, but at least you don't have to walk all the way to a bathroom. Turn off your cell phone, TV, or other devices 30 to 60 minutes before bed. Avoid eating a large meal before bed, but a light snack such as warm milk with turmeric may assist with sleep. Another thing, consider a warm bath before bed with the use of Epsom salt, but ask your doctor about this first. I did give a recommendation for someone on another topic for kind of de-stressing, and we talked about doing a warm bath with lavender Epsom salt, and she said that her oncologist stated that lavender was not good for cancer, so, or her particular type. So just anything that you implement or want to implement, just touch base with your doctor first, which was interesting because I didn't know that. Journal before bed to avoid taking stress and thoughts to bed. So if any of you attended my lunch and learn on expressive writing, kind of falls in line with that of write it out, get it out, clear your mind. Now my thoughts exist on paper, but I don't need to take them to bed. Use your bed for only sleep and intimacy. And go to bed when you are tired. And if you're laying in bed and cannot get to sleep or you feel restless, it's best to get out of bed and do a light activity such as reading, low light too, but you don't want to use light from a phone. If you have like a little lamp next to on a side table, even though that's on like a 3-way switch with the lowest light that you can still read is the best, because you don't want to get up and going. You just want something, you don't want to lay in bed, but you don't want anything too exciting for your body to be like, okay, I'm ready to go a whole day again. And make sure your room is a comfortable temperature. 65 degrees is recommended for sleeping. And discuss with your doctor the use of melatonin. That can be a great resource. The melatonin gummies, or I think you can take it in liquid form too. Diet and nutrition. So diets that may reduce inflammation, such as a Mediterranean diet and a plant-based diet, may reduce CRF. Macronutrients, protein. Protein is important for maintaining and building lean muscle mass, and lean muscle mass has shown to reduce CRF. Whey protein is considered an excellent protein source for maintaining muscle. And even if you're watching your calories, there's so many options. I myself do vegan protein, but that also is really high in protein. Most of my proteins are 24 grams, all the way up to 30 grams of protein. So that's a lucky part of that industry. It has grown so much that there's many options out there. Fatty acids. So ingesting omega-3 fatty acids, both through a marine source and a plant-based source, such as flax seeds, may reduce inflammation levels. There's a ton of research out there that just maintaining low level of chronic inflammation really affects feelings of fatigue and energy. So flax seeds that you can add to smoothies are a great source of fatty acids. If someone isn't a fish fan, but if you are a fish fan, salmon is kind of the known omega-3 source. Inflammation is considered one of the main mechanisms behind fatigue in cancer survivors. Therefore, an increase of omega-3 fatty acids appears helpful per research. Carbohydrates, refined carbohydrates and diets and sugar are pro-inflammatory, which fuels CRF. So another study that I read just had cancer patients doing a completely carb-free or low-carb diet, and they rated their measures of cancer-related fatigue over a certain period of time. And they found people who followed this Mediterranean diet or plant-based diet with really complete, they really did not take in any carbohydrates. They felt better, they moved better, and their energy levels were increased. So we need carbohydrates, but they can be tough when your body responds in a pro-inflammatory way. Micronutrients, so your vitamins and minerals. Anemia. Anemia is very common with cancer patients, particularly iron deficiency or B12 deficiency is common, and another cause of fatigue and impaired physical function in cancer survivors. So there are natural sources of B12, obviously discuss with your doctor B12 injections. But if you're not at the level where you want or need an injection, there are natural sources of B12, which includes animal liver and animal kidneys. If you can get your head into that, it can be a good source. Clams, beef, tuna, salmon, eggs, and I believe dairy into your diet. Fat-soluble vitamins, which are vitamins A, D, E, and K. Deficiencies, especially vitamin D, are especially common in cancer patients. So again, these can be sourced through natural sources with food, or they can be prescribed via your medical doctor or additives. Probiotic and prebiotic supplements. The use of probiotics to correct an imbalanced gut microbiome is associated with reduced pro-inflammatory markers. So yeah, adding a probiotic into your daily routine can be really important for maintaining that gut health and feeling sluggy in that way. Again, any of these supplements you want to discuss with your doctor, but if you feel particularly slow in that area, they can make a difference. And again, add to your overall daily functioning and how you feel. And I think most people can attest, like when their tummy feels off, you're like, oh, I wanted to go to the gym today, but I'm just like, I'm feeling off. It can also lead into a vicious cycle. Herbal supplements. Supplementation with ginseng, ginger, or probiotics can improve cancer survivors' energy levels. But again, discuss this with your doctor prior to implementing into your diet. So again, what I touched on earlier, the turmeric with warm milk can aid with sleeping. But I take a supplement called Golden Milk, which is turmeric, ginger, cinnamon, pepper, and has amazing benefits for inflammation, joint mobility. So it can help. Exercise, strength and cardio exercise. I looked into a couple studies, and for these studies, the participants participated in moderate intensity continuous aerobic exercise, which they followed by high intensity intervals training with strength. So just resistance exercises. So they would go between, running on a treadmill, doing a bike, and then strength exercises with weights or strength equipment. And it was found to be efficacious for decreasing CRF symptoms. Effective resistance exercises include using a leg press, a bicep curl, tricep extension, bench press, shoulder press, a standing row. So this movement, sit-ups, or Russian twist with an abdominal twist, a Russian weighted abdominal twist, which is basically just sitting on the ground. Usually you're using a medicine ball and just twisting your torso back and forth. And prone lying back extension. So laying on your tummy and raising your neck up. Another study identified that engagement in high intensity interval training, a combination of both strength and cardio-based exercise, is important to reduce cancer-related fatigue. So there were several studies that I looked at, and they all came to the same conclusion that incorporating strength and cardio is efficacious for reduce cancer-related fatigue. A couple other studies looked at just cardio only, and they implemented walking exercise programs. And with one study with participants, they did, I guess it's kind of like a tiered exercise walking program. And they found that over time, they're, basically like anything else, participants built up to it, what they could do, how they felt after. So maybe like 5 minutes of walking, 10 minutes of walking, 15, and so on. And they also found that cardio-based exercise programs show reduction in CRF symptoms. So it's really just doing what you're able to do at the time. Takeaways. Reduction of CRF symptoms involves a multi-level intervention approach. It is important to focus on sleep, diet, exercise, and ADL modification as a combination approach. So really, it's important to look at everything in an all-encompassing way. What your baseline was before feeling this cancer-related fatigue, where you're at now, and where you want to get to. What things you're willing to implement or want to implement. If you want to join a gym and start an exercise program, if you are finding that you're vitamin deficient and want to try different foods, it's really just kind of trial and error too. Focus on IADL completion first, and then implement your cardio and cardio strength exercise. So it's really important to maintain your ability to be as independent as possible with your activities of daily living. And then when you have the energy to implement back in an exercise program, then take it from there. But if all you can do in a day is get dressed and take a shower or make a simple meal for yourself, you kind of have to you just have to meet yourself where you're at right now. So this is where it's important to, if you are at that level where you can bring other factors into your routine, consider working with a trainer who has experience training cancer patients, and consider consulting with a registered dietitian to personally address your nutrition deficits and your nutrition goals. Discuss with your doctor adding any supplements in your diet and the use of essential oils, Epsom salt, and lavender oil. I know of them somewhat. I'm a personal user, but that's where Lily is so great for the herbologist, because she knows a little more in depth on the use of these essential oils and how to use them safely. But again, just consult your doctor with anything. And the internet can be a source of great information and misinformation. So feel free to always seek out your own information, but take it to your medical team to validate it and find its particular use for you. Okay, if you guys want to, feel free to unmute yourself if you have any questions.
Thanks so much, Sarah. We have a couple thank yous in the chat. So yeah, lots of great information here.
Good. Yeah. And Angie can pass this on to you, and you guys can see the fatigue symptom inventory to go through. It's hard to see on the screen, I know. My email is on this page if anyone wants to reach out and talk about anything further.
Yeah. I have offered unmute to you all if anybody wants to ask any question.
I don't have a question. I just like to use my crock